Hello, everyone, and welcome to the third audio or podcast series in relating to the V2 edition. This is the Shientist, and this is the first audio podcast in relating to the molecular storm gauge V2. In the last sort of introduction audio podcast series around the molecular storm gauge, we talked a little bit about some topics relating to better healthcare needs smarter science, research and laboratory investigations, science and the multiverse, population health and grouping vasculatures, faith, science and medicine, a perpetual link, health critically, engaging science with impact, and then science looking at discrimination, ignorance, and healthcare indentation. The molecular storm gauge audio podcast series and the list of topics that I highlighted are part of the molecular storm gauge audio podcast series that took place actually in December 2021. So in following up, I'm now going to set off with another series under the storm molecular gauge as the molecular storm gauge. This is V2. It's another storm lobostics production. And today I'm going to give you an overview on a topic relating to biomedical visualizations. Now, this is collaborative work that actually whereupon colleagues have collaborated between the Renal Patient Support Group, the RPSG, and a colleague at an academic institution here in the UK. And basically, the colleagues were actually called upon to actually provide an overview on a topic relating to a theme titled, or an overarching theme, advanced microscopy and visualization of host pathogen communication. Now, the works that the colleagues have put together around this was actually relating to kidney care practice, and the subject is around a review of pathology and analysis of approaches to easing kidney disease burden, host pathogen communication, and biomedical visualization perspective. And this work in this audio or podcast as part of this particular storm lobostics production, I'm going to just provide an overview of this particular subject, this particular work, just by highlighting what has been put together as part of the abstract around this work before it has gone before it has been being prepared for peer review. So I'm going to go ahead and just read the abstract around this work. So the introduction, first and foremost. So apart from affecting the upper respiratory tract, severe acute respiratory syndrome coronavirus, or SARS-CoV, and by SARS-CoV, by the way, listeners, basically I'm talking about the team who put this work together, or the colleagues who put this work together, are talking about looking at SARS-CoV, the outbreak that took place in 2003 back in China, and look at SARS-CoV, and the SARS virus, sorry, and then look at SARS-CoV-2, which is relating to the coronavirus, which stems from the SARS virus, where the outbreak took place in the Wuhan province of China in late 2018, early 2019, or thereabouts. And so basically, the introduction of this work reads as follows: apart from affecting the upper respiratory tract, severe acute respiratory syndrome, coronavirus, or SARS-CoV and SARS-CoV-2 can target kidneys, resulting in disease burden. Where there is a lack of effective treatment for SARS-CoV and SARS-CoV-2, a more indirect approach should be considered to lower probable risk and onset of disease amongst immunosuppressed and immunocompromised individuals, and of course patients. Now, in relating to this, the colleagues have actually highlighted that angiotensin, something referred to as angiotensin converting enzyme inhibitor 2, or ACE2, has promising impact, including acting against symptoms accompanied to that of SARS-CoV and SARS-CoV-2. Literature informs that ACE2, or the angiotensin converting enzyme inhibitor, is expressed across several physiological systems, including the lungs, the cardiovascular system, the gut, the kidneys, and central nervous system, and also intriguingly, where these organs are concerned, this ACE2 can also be expressed across endothelia, or tissue cells that are lined with these particular organs. Now, this is important because ACE2 traditionally is used as an antihypertensive form of treatment in patients who are actually, or individuals or patients who are suspect or high risk for chronic kidney disease, or falling into the physiological compromise that relates to around chronic kidney disease or kidney disease. Now, the colleagues here in this work, the aims, I'm going to read the aims now. Basically, the works are about where the colleagues were fortunate to be invited to put together a context in relating to a book chapter. So the works was actually an invited book chapter on this particular topic, and the aims were that the chapter looks to investigate causes and potential mechanisms during SARS infection, and particularly around CoV-2, renal interaction, or the kidney interaction around that, and the potential effects that relate to acute kidney injury, or AKI. Now, around this, there were a few objectives as well. So the work looked to provide an understanding or perspective, at least, around the microscopy and visualization of what's referred to as host pathogen communication. So what the colleagues are doing in this work, or in this sort of review, is basically look to highlight through laboratory practice how microscopy, and through microscopy the visualization around how cell types communicate to an extent where pathogen where there's basically where the pathogen causes compromise in where patients are already, or individuals might be immunosuppressed or immunocompromised, but where pathogen causes its deficit or issues around physiological health, and where the host, i.e., wherein the human the body or the physiological part that is most compromised around an individual, that is referred to as a host. So the host pathogen communication is sort of interrogated, where these the host pathogen communication aspects are interrogated in the works that these colleagues have collaborated to highlight a perspective on. And basically they look at the principles of ACE2 in context of not just microscopy and visualization, but also in context with immunology, so the immune system, and infection, to understand the burden of kidney disease around this. Now, it's quite a this ACE2 is quite an important topic as well, because the colleagues looked at literature, and I haven't got enough time to provide perspective on this whole paper, because it is actually it is a chapter that is contributing to a particular book publication, but basically what these colleagues are doing or have done is look at sort of almost in a semi retrospective perspective way, looked at literature following where COVID-19 had caused problems generally around where the pandemic was concerned. There was a lot of literature that had been published. However, these colleagues had looked at literature that more or less focused on papers that had context relating to angiotensin converting enzyme inhibitor, and also looking at the immunology and microbiology aspects around this particular host pathogen communication sort of issue. Now, the design around this were whereby the core focus of the work was to provide the basic principles of activity within the kidney, and the analysis of the effects of immunology and pathological components, which would be important in the treatment and prevention of infection. Now, ACE2, where there are individuals who are suspect or high risk for kidney disease, let's say, ACE2, what happens is that once ACE2 is administered, basically what happens is that ACE2 enables the renin-angiotensin mechanism that is sort of housed as a mechanism to dilate afferent and efferent arterioles. Those are basically the arterioles are blood vessels that lead to and from the kidneys, and basically angiotensin, the angiotensin mechanism, and also the antihypertensive generally. What happens is that where these blood vessels are concerned, the mechanism allows the opening and closing of these arterioles, so there is an increase or decrease in blood flow. And obviously those who are compromised with for example with physiological systems, then basically angiotensin and the antihypertensive ACE2 is used or can be used to help dilate those blood vessels in particular individuals. Now, this was also known in papers, or at least the papers that have been referred to in this particular work. These colleagues actually did something quite phenomenal. They actually looked at ACE2 in a way whereby, for example, where people have sort of potential symptoms that relate to respiratory distress. So respiratory distress during the pandemic time was automatically referred to or looked at as a way that was causing COVID-19 symptoms. Now, those who are immunosuppressed or immunocompromised, in a way, fall into can be sort of labeled. I say that open with an open and close quote, labeled whereby, for example, they're labeled in a way that they have actual COVID-19 when actually, so labeled as having COVID-19 or COVID-19 symptoms, when actually they may have what are referred to as comorbidities that cause the respiratory distress. So these colleagues actually did a kind of as part of the design in this sort of work, they looked at the literature. They went back to the literature and tried to kind of put a perspective once again around the host pathogen. The host pathogen communication aspect that relate to this, and also once again provide a kind of a visualization of what's really happening from down to a physiological and microbiological and an immunological perspective. So on from this, what they've done is they looked at the literature as part of the design in this work, and again they looked at tried to understand whether from a physiological standpoint and also an immunological standpoint as well, whether ACE2 would have been beneficial in particular populations. So the discussion around this was thus: there has been a surge in literature surrounding sort of the mechanisms attributing to SARS-CoV and SARS-CoV-2 action on the immune system, on the immune response to pathogen. There is some advantage, there is some potential advantage to implementing ACE2 treatment to improve immune response against infection. And that's quite intriguing as well. And then the overall conclusion around this was that ACE2 may provide appropriate strategies for the management of symptoms that relate SARS-CoV and SARS-CoV-2 in most immunocompromised or immunosuppressed patients. Visualization of ACE2 action can be achieved through microscopy to understand host pathogen communication. Now, that's really an overall understanding in relating to the abstract around this work. There are key words that you're welcome to check out and put into a search database to find literature that relates to this work, to get sort of more perspective. And those key terminologies are words like nephrology, immunology, host pathogen, visualization, and biomedical sciences. This work will be made available once formally peer-reviewed and published. I was lucky. I was quite fortunate to get to be able to speak to my colleagues about providing this perspective, and so basically this work will be available through the Renal Patient Support Group, the RPSG, in due course, or in due time. But one of the aspects that had also come out of this work was that so we know, for example, we know also that there is there's been a vaccination program globally as well, and basically what had not been sort of trialed or kind of piloted or investigated was whether ACE2 could be administered in the general population as a way to potentially offset any potential symptoms that relate to COVID-19 or in some way or another. Now, obviously, in parts of this work, the authors actually sort of interrogate the literature to understand, to kind of put a perspective on that, and in some regard, where there have been people, there's this aspect where people have been sort of who have passed away, for example, from COVID-19, where they have specifically had COVID-19, but whether ACE2 could have prevented some of those symptoms, what the authors do in this work from a literature overview perspective was that actually angiotensin converting enzyme, or ACE2, potentially could have actually prevented respiratory distress in those who are who would have potentially no symptoms of COVID-19, and actually in some regard would have preserved some aspect of physiological health as well. However, that being said, what we will never know, and what we will never know, and what has not been done, is whether that intervention versus a vaccination program that has been implemented would have whether that would have been beneficial or advantageous. Now, obviously, it's a question, and on that basis, I'm going to draw this audio and podcast to a close so that people can kind of think about that aspect in relating to physiological health, as well as in some aspects the immunological aspects around that as well. Thank you for listening. This has been the Shientist, and it's been the molecular storm gauge V2, and this has been an audio podcast on biomedical visualizations, and this has been another Ztorm Robotics production. Thank you for taking the time to check this out.